Before I start, I do want to state that a little bit of a reason as to why we're going to be focusing on the scientific evidence today. Now, you've probably read my blurb before coming on to this session, but the reason why we're looking predominantly at the science is because, well, first, I want to acknowledge that a lot of you are currently living through the COVID pandemic, and you have some in-depth understanding in regards to the people around, how COVID has affected the people around you. The advantage of the scientific evidence is that I'm hoping to give you some accurate understanding in regards to how COVID has affected people. But more than that, I want to give you a normative understanding as well. So how has it affected the people around us, allowing us to contextualize our current understanding of COVID that we've picked up from observing other people around us, and understanding that as in the context of the experience of all the people around us. Sorry, I'll try not to look at the chat bot at the moment. There is some weaknesses in the scientific evidence at the moment, and the key weakness here is that it's still in very early stages. So there is only some general insights I can give. There's a lot of more specific topics that lots of people would still love answers to, but it's just a little bit too early to have some solid scientific evidence for that. And I think too many people, like, there is a lot of speculation at the moment, but I'll try not to speculate too much on the details in regards to this. Also, I want to give you a little bit of an initial warning. Some of the research topics I'll be covering today might evoke some strong emotional reactions. If you do feel distressed after this talk, do book a session with one of our Uprise coaches, or do call Lifeline on 131114. You can always just Google Lifeline to find their phone number as well. Now, a quick overview as to what I'll be talking about today. Let me jump straight into it. How has COVID affected our well-being? Now, we have some initial statistics out already from the first month of lockdown, that is over April. I know, yes, lockdown started in March, but this data was taken looking just at how the effects of lockdown affected Australians within that month. Now, two things to look at. Whenever we look at mood-related issues, predominantly people look at the three factors of depression, stress, and anxiety. To give you a little bit of a definition, and I'm sure you already have a definition of this and understand what depression and anxiety means, but in a scientific way of thinking, depression is defined as a lack of positive affect, that is, the lack of positive feelings. So you can feel neutral, you can feel down, but you find it hard to feel positive. And in terms of anxiety, that is defined as a heightened autonomic arousal. So I'm sure a lot of you have heard of the fight or flight instinct. That is, anxiety is the consistent feeling of that fight or flight compulsion. A little bit of statistics over that month. It was found that 26.5% of Australians felt mild symptoms of depression, where 27.6% experienced moderate to severe symptoms. And why do I distinguish it that way? Moderate and severe symptoms is where it starts being deemed as a clinical case of depression. And there's a little bit of complexity to that, but very simply, just a higher level of intervention is usually suggested or advised for those individuals. In the past, in terms of depression, within Australia, we reported around a 11% rate of people who experience moderate to severe levels of depression, and that's near tripled, more closer to just over kind of around 2.5 times the previous rates. In terms of anxiety, in terms of mild symptomology, 24.5%, moderate to severe, again, on a clinical level of anxiety, 21% was reported within Australians, up from 13%, so just less than double. And of course, that overall number is also concerning. The idea that around half of all Australians experience depression or have experienced depression or anxiety over that first month of lockdown. In terms of irritability, that was looked at as well. Now, the research looked specifically at whether the individual experienced an increased level of normal irritability and how many days a week they experienced that. So individuals who experienced that several days a week, that counted up to 35.5%. More than half of the days a week, they felt more irritable than normal. That was up to 23.7%. Now, there hasn't been a lot of comparative data within Australia, but within a small sample, it was found that the total increased level of irritability was at 35.1%. So an increase, but not nearly as drastic, perhaps, as in depression or anxiety. And finally, Australians tend to have been strongly optimistic in regards to the future. In fact, that doesn't seem to have changed very much over the last year or so. In terms of current statistics, that's a little bit harder to find, but a great indication for how Australians' moods has changed over the last few years or in reaction to COVID can be seen in how many people have been calling our various assistance lines. So for example, calls to Beyond Blue. Now, the last statistic was taken here in April in 2021. And what you can see is that number had rose from 2019 to 2021 by 30.7%, but has actually decreased from the same time last year by 14.9%. Now, I should note a few interesting things about this data. One, the peak of poor well-being happened during 2020 in around that July, August time, and then again in September, and that that coincides with the second wave that was experienced within Australia, particularly affecting Victoria. And a little bit of further information, if you can think this far back, remember this far back, towards the end of 2019, we can see that numbers also went up, and that was most likely to do with the bushfires within Australia, which started around mid-June and extended until early March of 2020. Of course, we don't have very much information in regards to our current lockdown, but what we do expect is a little bit of a spike again, similar to what we saw in 2020. Now, I just want to Arnell, fantastic question. It's just the nature of statistics. In 2007, that was when a national wellbeing survey was conducted within Australia. That was the last time a national survey like this was conducted. Now, I'd love to ask, fantastic, thanks, Carl. What have your experiences been? Thinking work life, home life, your friends, people around you, have they experienced a higher or lower amount of kind of these mood disorders? Love to have your responses there. Yeah, yes, absolutely. That is so tough to hear, absolutely. And I have to agree, for me as well, amongst my friendship circles, definitely I would say it's higher than these numbers, but very interesting. Consistently higher. Wow. Absolutely. Thanks for your feedback. Yeah, that's also really helpful for me to know in my position as well. Yeah, absolutely. This is where it gets a little bit more troubling as well. For most people in the mental health circles, we're really interested in knowing what the long-term effects of COVID is going to be on Australia and in society as a whole. Evidence from past pandemics had shown that long-term effects in terms of mental health can include anything from kind of chronic conditions like PTSD and self-harm. It could range to a lot of other things as well. Now, the unique thing about COVID is it has affected people from all around the world, and it has affected Australians to quite a degree as well. So we haven't come out of COVID yet, and so we don't have the science as to what the long-term effects are going to be, but it's good to be aware of what it could be so we can begin to prepare for it. In terms of that, there's also questions in regards to the long-term physiological effects of COVID. In particular, like we've heard a little bit about possible long-term effects to our taste, or our sense of smell, etc. Other breathing problems could be a long-term effect. Again, we're not sure as to what exactly that's looking like at the moment, and so we don't want to speculate too much into it, but it's worthwhile being prepared in advance of time. Second, I'm going to have a quick look at who has been impacted by COVID. Now, we all know that everyone has been impacted by COVID, but I do want to look at a few particular areas of concern that has been identified by literature. Of course, frontline and healthcare professionals have been severely affected, but in terms of their well-being levels, being on the coalface, dealing with the stresses of the COVID situation. Of course, those with low financial security as well has been impacted, especially within the Australian context. That has had a unique kind of situation. We have a unique situation within Australia in the sense that, yes, we have financial support from the government, but those financial security questions still impact a few key demographics like small business owners, etc. Research has shown that those under 25 has been most affected, even compared to those who are above 65 in terms of well-being. And in particular, one of the most high-risk groups are adolescents, particularly the loss of routine, the increase in use of various kind of digital media, and the effect that has on both immediate kind of well-being as well as developmental questions have been of concern. As well as that, a marked increase in poor well-being amongst employed parents with children, particularly when the youngest child in the household are between 5 to 11 years old. Statistically, women are more likely to report poor well-being than men. In particular, women report symptoms of loneliness twice as much than men within an Australian setting, and as well as that, poor kind of other mood-related issues as well. It could be a symptom of the fact that men tend to not be very open in reporting personal well-being levels and feelings, but that's just what our initial information has told us. Those with pre-existing chronic conditions also have been of serious concern as well. In some area, fantastic. I personally haven't looked too much into research in regards to international students. I'm sure there are a lot of other vulnerable groups within the Australian context. Again, maybe haven't looked conclusively into the science, but at the moment, scientific research has been a little bit sparse. Absolutely. Now, I don't want to just be talking about statistics and science all day. I do want to humanize this a little bit for us today. I want to give you the opportunity, give an opportunity for individuals here to share their experiences for us as well. While you type a response to this question that I have on screen, I do want to share a little bit maybe as to my personal experience as well. Now, I personally don't fit into any of these categories. I am a male living at home, etc., by myself, etc. But I have to say, for myself, when I think about these categories, the first thing I think about is my first person I think about is my grandmother. She has failing health. She was extremely social, loved seeing friends, loved visiting all of the different families within Australia. Now she doesn't even feel right going out to do grocery shopping. She doesn't want to go outside. She's too scared to have us visit her. She was actually really hesitant in regards to the COVID vaccinations until this recent outbreak again. And she's gone specifically in regards to the side effects of the vaccination, but she's gotten vaccinated anyway now, despite those fears. Of course, really, really worried about her in her current situation, and really trying to think of various ways we can continue being in touch with her and support her as we go forward. So if you guys have any experiences that you'd like to share, feel free to throw it up on that chat. Yeah, absolutely. Fantastic. Feel free to continue those responses. It's really, really helpful to have some of this mutual understanding going forward as well. Let me continue. Definitely keep on throwing those things in the chat box, and I definitely will read them, if not after today's session. How is COVID affecting our well-being? Let me have a look at a few of the different ways the COVID situation has been affecting us. Now, when COVID first hit, we all experienced this. I'll try not to go into too much detail. I'll just try to outline some of the general experience. At the beginning, there was an initial lack of clear information as to what COVID looked like. We had a very mixed amount of information. There was a lot of speculation as to how dangerous it was and how it will affect society as a whole. We suddenly got a sudden notification that confinement was needed for various different things, including to avoid the collapse of our healthcare system. That kind of news is terrifying, right? Like, we had a fear of the sickness itself. We didn't know how its effects will have on us, as well as that it affected our perception of the future as well. We didn't know how it was going to affect our jobs. We didn't know how it was going to affect our toilet paper supplies. And then on top of that as well, we didn't know how it was going to affect us or our loved ones. And finally as well, it affected us in a strong way because none of us have had a set of routines or habits that's been designed to help us or support us in this novel situation. And so well-being was strongly affected by an ability to maintain sleep habits, etc. as well. Understanding I'm running out of time, so let me speed up a little bit. It affected our finances as well. It caused a lot of our organizations to stop operations. It caused a lot of financial loss. The long-term effects of COVID in terms of finances are still unknown, but as well as that, even if for those who still have a job within this COVID pandemic period, our internal data actually shows that people who do have jobs are experiencing really novel stresses. People are reporting feeling overworked, possibly because there is a lot of additional work to do in this period, especially with all the disruptions in our regular workflow. There has been an increase in terms of conflict with fellow colleagues, possibly because we are all individually feeling more stressed. And there has been an increase in uncertainties around job roles, etc. In Australia, we've been lucky in some ways, in the sense that a very small proportion of us have fallen ill to COVID, but there are so many uncertainties around COVID, getting sicknesses, whether we'll recover, how well we'll recover, the long-term effects of COVID, etc. as well. This is just on a personal level, But as well as that, on a wider level as well, the effects of COVID has impacted our ability for compassion, if I have to admit, right? Like, it has caused so much human suffering that on one hand, it's kind of fatigued our ability for compassion. It has actually restricted our ability to mourn for those people who have experienced loss, and as well as that, to kind of just, I hate to say it, just feel like for people who have experienced loss, just being able to contextualize that. Sorry. I'll just hint very quickly in regards to this, the status of vaccines, both in terms of individual hesitancy to procure vaccines, as well as the lack of vaccines within the Australian context, should be noted. Of course, follow the advice of your doctor in regards to that. In terms of the effects of the imposed quarantine, we are all experiencing that now. I found one of my friends sent a great meme to me the other day. A word called Corona Coaster is something that I personally have experienced quite a lot. That is the up and down of the pandemic. One day you're feeling great, the other day you're feeling really stressed out. This is something that has been reflected strongly within the literature as well. In particular, during the first days of COVID, during lockdown, many people feel a sense of relief, a sense of freedom, sense like they're on holidays. Quickly, people develop a sense of anxiety. Often people don't know why they're feeling the way they're feeling. They just know they're feeling it. Some speculation, some scientific, let's just say scientific speculations point towards possibly the effects of social isolation, lack of mental hygiene habits, repeated exposure to negative news and information to be the cause of those different areas. I want to focus specifically on the effects of social isolation. I don't want to I want to emphasize how important it is to consider social isolation as a factor in our personal well-being. I just want to quickly note that on a biological level, social isolation has strong effects on poor well-being. In fact, some research shows that it has a similar effect on our well-being as consistent hunger, for example, like very base level needs. And in particular, this is of concern because social connectedness is a strong mechanism in helping us developing coping mechanisms. So without this level of social connectedness, it is not only hurting our well-being on an initial level, but also our ability to cope with poor well-being or stressful situations. I only have a few minutes left, so I'm going to be rushing through the last section. I'm very, very sorry about my time management, but if you do have any questions, do feel free to ask us after today's session. I want to touch very quickly on what we can do about this current situation. As individuals, I would advise a few separate steps. First, I would always say, schedule in some time to stop what you're doing. And in that scheduled amount of time, ask yourself a few questions. How are your health basics, right? By health basics, I just mean those basic hygiene habits, whether it be exercise, your sleeping habits, your current diet, whether you're making time to see friends. Second, on an emotional level, how are you feeling? Like, how are you feeling about work? How are you feeling about your home life? How are you feeling about the COVID situation? Define those feelings. Possibly write that down using emotional words if possible. And then third, what are you in control of and what do you need help with? So definitely outline various areas where, yes, I feel like I'm in control. Other areas you might need more help with. Rodney, this is fantastic question in regards to reading too much about COVID. Your source of information like reading in regards to COVID can be a impulse that's driven by our anxiety. So it is really, really important to be able to limit our amount of news that we get, and also try to get our news only from the best sources. This is the way we get news is the way we control the information that we're consuming during this period is one of these areas that you should definitely question and see if you're in control of. I want to share with you two quick well-being skills. Now, in terms of mindfulness, I know we have quite a lot of our webinars in regards to mindfulness. In fact, the next mindfulness webinar is led by a fantastic chap who has a background in a range of different practices, mindfulness practices. I want to say I personally don't have a background in yoga or Eastern spiritualities, but there is a wealth of scientific evidence showing how effective mindfulness is in supporting personal well-being. That includes research showing that for those who are in high-stress multitasking jobs, they can complete their jobs more efficiently and more quickly with a greater level of memory retention for those roles. Research looking at psychologists have shown that psychologists who practice mindfulness tend to avoid burnout more effectively than adopting any other career-sustaining behaviors, including regularly taking breaks, getting support from others, etc. And finally, as well, in terms of mental realignment, I don't think I have time to touch on that just now, but I do want to emphasize before I close up from today's session, if you need any further assistance, do reach out to somebody. I also want to give you this resource if you are checking in from an organization. A great resource is this report developed by the Black Dog Institute. It's called The Mental Health Ramifications of COVID 2019. The Australian context, they'll give you some great resources in regards to what I have covered today.